Hi, ladies and gentlemen. Welcome to the Empowered Collective. I'm Lana Mazer, also known as Curated by the Cougar. And it's funny because I had this whole thing planned out of what I was gonna say sitting down here. And the thing that I kept on thinking about what I wanted to say and what's most important to me and why we're here today is really about building community. And I feel so strongly about that because I am 48, and when I turned 40, a lot of things started to happen for me over the last 8 years. Significant life-altering changes. One of those things was a close friend of mine passed away. I went through a divorce, and what I realized was most significant and important to me that got me through those times was community of women, having women that I could talk to and surround myself with, strong, smart, supportive women. And especially I find that as we age, because that's what we do, there are a lot of things that come up for all of us that we want to be able to talk about and maybe feel that we're being heard and our questions are answered, and we can have those conversations in a safe, supportive space. And so what I am bringing here today, what we're all bringing here today, is I have these fabulous ladies here with me, and they're going to introduce themselves, but really finding a way to get through this journey as we age and feeling confident about ourselves, feeling excited, redefining who we are. I've redefined my hair a million times. But really figuring out who we are and feeling really good about that. Finding that spark, maybe if we've lost that spark. And I know for myself, that spark dimmed for a while, and now it's back and shining really brightly. And that's just because, again, I went through a lot of these significant things, and I had really strong people around me. And so creating this community is what I'm really passionate about. On Instagram, my IG is Curated by the Cougar, but I also have a podcast called The Cougar, the Bitch, and the Wardrobe. And what that's about is really reclaiming what those words mean. What makes a woman a cougar? Why does a woman have to be a cougar? Why is she a bitch? She doesn't have to be, unless you want to be those things. But it's about reclaiming that identity. So with that being said, we're gonna get started, and I'll have each of these fabulous women introduce themselves. They all have amazing stories and expertise to share with you. And we're just gonna have a conversation with Q&A. And once that part is over, we're gonna break into some fireside chats. So that way, if you have questions that maybe you want to explore more in depth, or you feel uncomfortable speaking in this arena, you can have a conversation off to the side. So with that being said, again, welcome. I'm so glad everyone's here. And would you like to introduce?
Sure.
Yeah, you have yours. Oh, you can fine.
Hi everyone, my name is Dr. Sonali Lal. I'm a physician. I practice in New York City. I'm a professor at Columbia for the last 20 years, and my specialty is I focus on regenerative aesthetics and regenerative orthopedics. I really try to, I think I myself am also 48, and I understand a lot of the changes that happen to us and how we want to try to stay looking fabulous and feeling fabulous, and that's what I try to do for my patients.
Beverly.
Amazing. Hi, my name is Beverly Osemwenkhae. I'm the founder of Project B Wardrobe Consulting and now 34B. Project B is an image and wardrobe consulting company based in New York. I'm currently in New York and London, but moving back. We specialize everything about wardrobe editing to personal shopping, to helping women kind of step into their next level self. For me, it's more than just putting on a nice outfit. It's also about how I like to make my clients feel. I enjoy doing this. This for me is my dream job because I just love helping women kind of step into their next level self when it comes to style and fashion. And the ethos of my company is really helping women kind of shake things up and kind of get out of their comfort zone. And my clients hire me to kind of shake things up and also push them out of, again, their comfort zones, but also make them feel amazing and fabulous. That's me. My name is
Oh, there you go. All right, guys. Hi, I'm Sarah Jensen. I am a personal trainer and a coach of strength and conditioning. I specialize in women's training. So what that means for me is I work with teenage girls, prenatal, postpartum, peri, postmenopausal, and all the things in between that we have. What I've learned over the years and what I've personally gone through is I've learned we don't know what's going on in our bodies until it's happening, and then we don't know what we need to do to work with that, right? So I spend my days building foundations for women, coaching women through what their changes are and how we're gonna deal with it, things we need to do to combat those changes. So I'm kind of on a mission on helping women understand what's happening and how to deal with it and live a long life fully for decades to come.
Awesome. So we'll get started, and again, we're just gonna have a conversation, and anyone questions, we'll do that after. So I'm gonna start here with Beverly, and we can all sort of chime in, but talking about as we go through our bodies change, and how do you help your clients to continue to celebrate and express their personal style as we get older and as our bodies naturally change?
Yeah, I think that's a question that comes up a lot with my clients, whether they're going through transitions or work, and with their bodies changing, it really comes down to meeting them where they are. And we kind of have to give ourselves permission to have fun with our personal style. And there's a lot of things in society where like women at a certain age have to dress a certain way, or if you're a mom, you can't wear that outfit, or I think it's about giving yourself permission to really be sexy and be fabulous. And what I kind of teach my clients is that I really want them to understand what their style identity is and really like own that. So my goal is kind of like going into their wardrobes, figuring out where they are now and how to help them get to the next level. So that comes down with teaching them how to dress for their bodies now, how to elevate their personal style, how to mix and match, how to have fun with like fashion, because there's so much rules and there's so many like what things that you can't do and things that you could do, and there's so much influence on social media where we are constantly chasing trends instead of figuring out what works for us personally. So my goal is to really kind of help them figure that out, and then from there help them kind of build. So building could mean educating them on color, how to play with more color, again, how to shop their closets, how to figure out what their personal style identity is, because having great style, it is more than just like putting on a nice outfit, but it's actually more of like an armor. So it really kind of tells the world who you are and where you're going. So I kind of teach my clients that, again, it's about not just putting on something cute and then leaving, but how does this outfit actually make you feel? And also learning how to dress for your body type, that definitely changes everything. So I kind of teach my clients that, and kind of, again, meet them where they are and kind of help them get into the mindset of like not being afraid to really step out of their comfort zone and kind of blocking out the noise of what people think that they should be, and using clothing and style as a catalyst to kind of get them to that next step. So I'm always like, who cares? Put it on, but how does it really make you feel? So that's kind of
I love that. I think it's so interesting too, because I I really believe that fashion, or how we put ourselves together, is really our way of communicating without even speaking.
Right.
So it's really what is presented before you even open your mouth.
Yeah, and
Yeah.
it's also like that first impression. And I always
Yes.
tell my clients, how do you want to be remembered when you come in, but also when you leave the room? So whether you're going to a networking event, like, do you want to leave the room being like, want to blend in, or do you want to be like, I want to make that mark? So, or a job interview, like, you want to always kind of leave your mark. And I think clothing, we we kind of can't overlook our style, even though it sounds a little bit superficial to say, because it really is an identity piece of who we are, and people make that judgment the first 5-10 seconds as you walk in the room. They're like, oh, like, she's confident based on how she stands, how she speaks, how she shows up. Oh, that's a great color. People remember all this detail. So I always say, like, try not to overlook your style. Always maybe take that extra 5 minutes on Sunday just to like put things together, make that extra, be more intentional
Yes.
with how you show up.
And so I want to ask next, because, obviously for many women in their 40s and beyond, we juggle multiple roles. So what are some style strategies that make getting dressed feel effortless, or what advice would you give for that?
I always say your closet is the foundation of everything. If you want to know where you are with your current style, look at what you own, because it tells a lot of different stories. A lot of people, we don't really edit our closets, and we feel kind of stagnant and be like, I don't even know where to actually start. So I always say, look at the closet, get an idea on what you like, but also things are not actually serving you, and then kind of clear the clutter a bit and can kind of make room for like things that actually is aligned with who you are, but also with your next level self, because you don't want to dress where you are now, because it becomes a little bit uninspiring. You'll be like, this is where I actually want to go, and that also makes fashion and getting dressed a lot more fun.
And also, so not being stagnant, and also having possibly those pieces that can really be styled maybe for day into night. And
yeah, I think it's just about having fun with your style. And there's so much rules of like what we can't do, and you can't wear that, and that's not appropriate, and then I think we need to just kind of wear what feels good to us, and wear what makes us feel amazing and confident, because that translates into your day like subconsciously. You could be inspiring to like the woman that's sitting right next to you because you're wearing something so fab, it's like, wow, like that's a really nice outfit, maybe I'll try that. So you don't know who you're inspiring daily. So I always think it's really important to just kind of like own your personal look and really just have fun with it.
I love to tell a story about when Beverly and I first met, and I think I just turned 40, and I went to see her, and she was styling me, and she took out this crop top, and I said, I can't wear a crop top, and now I rock a crop top on a regular basis. But again, it was just like this idea in my head. I said to her, well, I'm a mom, like I can't be wearing a crop top. And she's like, you can wear a crop top.
Yeah,
Yes.
what would people actually think, right?
Right.
I
So it's
think a
getting
lot of women-
over that.
Yeah,
Yes.
I think it's
Yeah.
kind of like we're getting in our own way whenever it comes to our personal style. That it's more of like what people think that you should wear, or how would I be seen, or what will be said, and it's like, who cares? Like, just wear what feels good.
It's
right?
true. And to play off of what Beverly is saying and talking about confidence, I think so much of that, at least in my experience, is fitness. And so for me, I've always, in some aspect, been exercising. In the last year and a half, I started going to a gym where I met Sarah, and that really changed things for me significantly, because it was really focused on strength training. And I know it's being shoved down our throats like 24/7 about like strength training and protein. But there is a lot of validity to that. and especially as we get older and we move into perimenopause and menopause. So I would love for Sarah to speak to us about that and really explain to us what is strength training and why should we be doing it? Not just what we see on Instagram. So I want you to hear it from the expert.
This passion of mine, I know it's shoved down everybody's throat, and you've all heard it, so I'm glad, I'm happy for that. My job is to make sure the women that I work with feel safe, number one, and two, I want them to fall in love with it, right? I want you to learn to like strength training because it's intimidating. And I had this thought the other day, and it kind of feeds off of what you were saying, Beverly, about not caring what other people think. I work with women of all different shapes and sizes, and I truly think these women who are moving heavy weights and strength training on the regular love their bodies more than the skinniest women I've ever met, right? Because they know what they can do with those bodies. As we grow older, as we get into that midlife, we start to have changes in our hormones, which have a profound effect on our body. Strength training is like that magic thing that can really help us combat those changes. When we think about bone health, strength training. When we think about metabolism, it's strength training, right? Muscle burns more calories at rest than fat does. So if you have more lean muscle, you're burning more calories naturally. Helps with glucose as you age and you get into that midlife. You're gonna have some people will have problems with insulin resistance. Lean muscle eats up glucose. It's a good way to manage that. You're gonna live a better quality life, and mentally, we don't talk about that part enough. Mentally, I don't know if any of you strength train now, moving really heavy weight will do a lot to help you deal with your life, right? And all the stuff that's going on with it. So there's just so many benefits to strength training that I do want women to feel empowered. I will say, what is strength training? It is not moving a weight that you can do 30 times in a row. It is not moving the same weight for your upper body that you're moving with your lower body. So it's not like doing a lunge into a bicep curl, right? Strength training is doing like 80 to 85% of what your max would be. So something that you can do 5 reps of, certainly no more than 10 to 12. And you generally need some sort of rest, like 1 minute up to 2 minutes of rest in between. So those HIIT style classes, they're not strength training classes, right? If you're interested in it and you haven't started yet, I would say invest and do research. And what I mean by that is it's really important for us to find the right people coaching us or training us in strength training. We want to build a solid foundation, learn the movements well, and we want to start with the right weights and progress. I mean, Lana can attest to this. She came in, had never strength trained. We made sure she could move really well. And she's built a lot of strength over the past year and a half. And she's in a place now where I'm telling her, you need the heavier dumbbell. It's time to go up. I'm making her. And you can see the change. You have to give it time though. It doesn't happen in 3 months. We have to consistently show up and do the work. You're gonna feel the change before you see the change, all right? And then, one more thing before I move on. Strength training is the priority. If we have to, that's what we should prioritize. But we can't stop doing cardio. And what I mean by cardio is your heart rate gets up and you're breathing heavy. So it's not a long walk with a weighted vest. No shade to the weighted vest. I love a weighted vest. But it's not cardio. That's like supplement. That's extra, right? We need to protect our hearts as we get older. Heart disease is the #1 killer of women. So cardio is really important to include because we need to make sure we're protecting our hearts. It's a lot of work for us to do. We have to be diligent as women. It's just how it is. Things have always been hard for us, and it doesn't get easier as we get older. It gets harder. And we have to show up and do the work consistently. So strength training is our #1 thing we can do to combat everything that's happening in our bodies, but cardio is still important. I have lots to say, but I don't want to take up all the time.
No, and I think, and this is actually a good segue also, because I would love for Dr. Sonali Lal to chime in also, because she has so much experience on the medical side with hormones and how also with exercise and how that's integrated and how we can help to manage that through those changes.
Hi, everyone. Hi, everyone. So, I mean, I honestly think this is a very exciting time, finally, perimenopause. I mean, suddenly now this word is everywhere. It's a word that wasn't even around 5 years ago. Now everything is perimenopause. And I think for years we'd have patients my age or, older, younger even, come in and say, something doesn't feel right. I just don't feel right. And you're like, oh, patient's anxious, patient's depressed, whatever, take an SSRI, take an antidepressant, get out of here. Now people are actually listening. And there's so much with perimenopause and this whole age of transition. And what is perimenopause? I mean, it is, it's actually it's this time before menopause. And menopause is actually, believe it or not, just one day, the day you stop your period. But there's this 10 to 15 years prior to that, which is, I think, definitely what I'm in. I don't know about anyone else, but it's this sort of vague, you've got weird symptoms, you're not really sure. So I think the number one thing is don't ignore what you have, and you don't know what you don't know. So number one, get blood work done. Or your primary care doctor, whatever it is, get your blood work done, find out what's happening, and not just basic blood work, but hormones. Like, know your hormones, know your insulin sensitivity. Just as Sarah said, like the number one killer is heart disease. So heart disease is the thing that probably most of us in this room are gonna die from, right? So if we don't take it seriously, it's going to get us. So getting your insulin, insulin is the silent killer, right? So getting fasting insulin, not just like a blood glucose. Yes, it's great to have a blood glucose monitor and everything like that, and that's wonderful, but getting your fasting insulin numbers are really what you wanna fight for. You wanna ask for your apolipoprotein B, which is a specific marker for your heart. So there's certain things that you want to be able to make sure like you're not just kind of being ignored, which is often what happens when women go to the doctor. That's why I always go to the female doctor. You don't get ignored. But certain things you really want to be asking for. Hormones. So I currently, I know this might be TMI, but I currently am on testosterone because I was having all the things like low muscle mass. Even if I was working out, I still had low muscle mass. I get an in-body done. I do I do an in-body, which is where you stand on a specific scale and it tells you all your skeletal muscle mass and how much is water. And I saw that I was like, wait, what the heck's going on here? I'm still working out, but I'm losing all this muscle mass. And I'll tell you why, because I was on a GLP. And I said, oh, I'm on Ozempic or I'm on Manjaro, and it's easy breezy from here. And this is before they knew a lot of the side effects. And I had developed severe sarcopenia, which is I lost a lot of muscle mass. So I was skinny, but then I was skinny fat. This was when we started working together. That's why none of my clothes fit anymore, because I had to stop it. But I suddenly became skinny, but then I had so much fat inside of me, which basically meant I was gonna die earlier, right? Because if your muscle mass, especially in your lower bodies, especially in your thighs, and they have measured this, there are studies on this, if you have poor quad strength, you have been shown that has been linked to an increased risk of death. So there's these tests that you can do, or how many squat, the easiest way to prevent that is make sure you're doing your squats. Because low quad strength, early death. Proven, not making this up. So anyways, so what happened with me was I was on the GLP, I got lazy because I was getting skinny anyway, so I was like, I don't have time to go to the gym. And then I lost all my muscle mass. Then I freaked out, and then I stopped it. And now I currently microdose myself on Mounjaro, and which is like a 0.25, it's a little low dose because there's a lot of benefits, and even that's not proven, it's all anecdotal, meaning they don't have studies on it, but they're saying that low dose of Mounjaro will help your heart, will help your dementia, and will bring down your inflammation, and also kind of control your weight.
Can I just tag on to your conversation with GLPs? So, no shame to GLPs. If anybody's on it or you're thinking about taking it, there's no shame in it. There is a necessity for it, and I've worked with many women. There are so many women out there that are using them. Most of them are not doing what they should be, the strength training piece, right? So my experience with women, I haven't been on it, but I've worked with women that have. We need to prioritize strength training. Again, we gotta protect that lean muscle. And there's two other things. One thing we notice are the side effects the day after you take the shot. So I actually have clients that we plan our sessions around when they take the shots, because the day after, 2 days after, it can be very nauseous, have headaches, and they're kind of worthless at the gym with me. So I know what day they're taking the shot, we plan our sessions around it. Number two, and you may be able to speak to this better, it works, which means you don't have an appetite. So this is a conversation I've had with many women about eating is your job. Make sure you eat breakfast, lunch, and dinner, because they have no desire, and then they eat something and they take 2 or 3 bites. And again, they come to me and they have no energy, they have no fuel, they can't, what they were doing before, the strength they had before, they can't match it because they just aren't nourished enough.
And they have to keep up with their protein.
They're not getting enough protein. And then nutrients as well.
Nutrients, of course.
Nutrients, so they're also taking multivitamins. So there's no shame to it, but you have to know what you're doing when you're getting into it, and do the right things. So if it's something you know somebody or you're thinking about it, strength training number one, make sure you fit it in, and then it works, you gotta protect, you gotta eat. I don't know if you have more to add to that.
Well, actually, I have a question, because I've read a lot of things that you were saying about quad strength, and they say that there's a direct correlation to having the lower body strength to also mental acuity, like Alzheimer's, pretty much. I've seen a lot of these.
For the
Yeah.
GLPs?
In general, just in building lower body strength, that it's so important that the strength in the quads is directly correlated to like brain health.
Yes.
Yeah.
Yeah, absolutely. I mean, I think overall, the most important thing is the goal is to decrease inflammation. So if it's in your, how do women most commonly die? It's heart. So right, if you're inflamed, you got a lot of sugar, you're diabetic, it's going to increase your risk. That's number one. Number two, many women, they get Alzheimer's. Alzheimer's is also now called diabetes 3. Yeah. So you want to make sure that your inflammation, and when you're strength training, when your diet is clean, your inflammation goes down. Yeah. I mean, I think the other thing is, what I would tell my patients is, make sure, especially right now, is, so I just did a Pronovo test. I don't know if anyone knows what that is. It's a full body MRI. It's the best thing I did. It gave me so much peace of mind, and it's not cheap. It's like $2,500, but you get this full body MRI, and you just kind of know, and it's just a way to check everything. And it's on 34th Street. I'm just so happy I did it, because
Yeah.
I get my hormones checked. So every 6 months, I get my blood work done, get all my hormones checked. Once a year, I do the Pronovo. And yeah, I mean, I do microdosing, and then and for my patients that have a lot of injuries, I give them BPC 157, which is a peptide, and then some of the changes that we see in perimenopause are skin changes, and it's a huge part of my practice. So for preventative, we have started giving patients GHKCU, which my son also takes, who's 14, God knows why, but it's for skin, and it helps for skin elasticity, because as we age, our collagen goes down, our skin gets like thinner, and the elasticity decreases, and then we get more pigmentation, especially in patients like my color, right?
So it's basically like a vaginal estriol cream that you're putting on your face.
So the next.
That's what my dermatologist gave
So
me. Actually, it's really fun.
0.25 is the
Yeah.
estriol that you should
Yes.
be putting on,
Yes.
and it helps with skin.
So I just have to tell a side note, funny story, is that, so my dermatologist was telling me, she's like, I'm gonna give you a prescription vaginal cream that you're gonna put on your face, and I was like, cool. Yeah.
That's her favorite word. I'm sorry.
And so they called it into Dwayne Reed, and when I got there, they're like, we need to tell you something, and I was like, okay, and they brought me like into the back, and they're like, it says that you're supposed to put it on your doctor said it goes on your face, but that's not where you're supposed to put it. And I was like, no, actually, she wants me to put it on my face. Okay, sorry. I didn't mean to interrupt.
That's 100% true though, and it's inexpensive if you can get it covered. Through
Yeah, that's why she.
much cheaper.
Right, because now, like, you'll see on Instagram, there are all these, like, alloy, I think, like, there are these companies that they're basically putting estrogen in the skin creams, but you're paying for
Yeah.
expensive skin cream.
Yeah,
Where
no,
all
just-
you need is a vaginal cream to put on your face.
Get a script for the vaginal cream, much
Can I
cheaper.
ask you something about that? As somebody that actually has to be very careful when I take estrogen,
Okay.
does it have an effect inside?
I mean, I think the amount that they tell you to do, it's like 0.25, it's so small, and it's supposed to be like half a
Tiny.
pea size.
Yeah.
I think it's in terms of like if you have a history of like, estrogen receptive breast cancer, meaning if you take estrogen, you increase the risk of your breast cancer. I think the risk is so minimal that they don't really think about it.
That's a great question, because that's a concern. You have to,
Yeah, I
Yes.
just wonder how it affects.
yes.
Can I ask you more about microdosing? Because I know that is something when, so I have clients that are on their GLPs, they're taking it once a week. At what point do they come off and then think about microdosing?
So I think that's a difficult question. I mean, in my practice, it's like crack. My patients will not get off of it. They will start fighting. I mean, I'm like, oh my God. They were like, I said, you need to stop. Like, this is getting ridiculous. I think it's a personal, and someone has to, like, for me, it was like when I saw the in-body, right? When I saw my like skeletal muscle mass going down so much and my fat level going up so much, and I was like, whoa. And I think it's a very, very hard decision for patients to make, because there is that fear, and a lot of the weight does come back.
Yeah.
If they don't, if you don't change your habits, and I tell patients, I said, think of this as like these 6 months as your window to get new habits. Get a trainer, take 100 grams of protein a day, let's do this right. Get it? I give them all the tools, and I say, let's have a plan for 6 months. But when 6 months comes, everyone starts freaking out. They're like, oh, no, just give me another month. I think it is someone that's consistently at a certain weight, they're happy with it, and then they don't really microdose, because the height, you can go to 2.5. So telling someone that's on 2.5 to go to 0.25, nobody wants that. So they'll taper down slowly, and hopefully at some point they will agree.
Okay.
But I will tell you, most of my patients, it's very hard to get people on.
I feel like that.
Yeah, and it's really just patients that don't, I mean, I don't know how else to say it, but it's people that are that are very slim and don't need it for weight loss, that are like, oh, I want a microdose for longevity.
Yeah.
But majority of them are like, I want to just give me the real stuff.
And so, talking about all of this, and obviously these are all different types and facets of self-care, and so I do want to segue to Beverly for a moment, just that how personal style, how that becomes part of a woman's self-care practice, and which is just as important in different ways as fitness, aesthetics, and reinforcing how we feel, how a woman feels about herself every day.
Yeah, I feel like I kind of said this before, that like how you get dressed kind of tells the world
Mine's on.
How we get dressed kind of tells the world how we feel about our like selves. So making that extra effort every day, or being intentional and planning your outfits, or just kind of figuring out what your personal style is, taking it up a notch, kind of helps you, again, pick out the right looks that actually works for like your body shape. So I think that personal style is self-care because it's part of who we are. As I mentioned before, your personal style is your is armor. How you show up is so important because it tells a story about who you are without saying anything. Going back to that 5 seconds of walking into a room and making that first impression, or like a first date or a job interview. It really, really tells the world how I feel about myself. So again, self-care could actually just be, you know what, I'm just gonna spend 30 minutes on a Sunday evening planning out my week of looks because I'm gonna show up and be the best version of myself. Or it could be, I wanna change something about how I dress, so maybe I should start with clearing out things that doesn't really serve me, going into the closet and just kind of taking out things that is not aligned with like who you are now. And then making room, which is, clothing holds a lot of
Yes.
it's energy.
Energy for
So if you clear out what actually doesn't serve you, then you are bringing in new energy of what actually does serve you. So those little tiny things, again, helps your personal confidence, it helps you mentally, it helps you build, just an overall look that you feel really, really great about. Because again, I always say that you don't need to take huge strides in your personal style. You don't need to be like, I want to change everything, I need a new closet. It can just come down to just saying, maybe I need to just shop a different brand, or maybe I should just do some research, or maybe just walking into a store that maybe you've never even shopped at and saying, let me just discover other brands that actually maybe align with my next level style, but not where I am now. Or maybe I just want to get my hair cut, so I just want to change things up. So I think little tiny steps is the best way of really helping your style overall, and then help you get there. Because I always say that is like personal style or having that effortless style is never actually effortless.
I don't think anything.
Not as effortless. So when you see that woman on the subway, she's like, wow, she's so put together. I mean, she probably is a little more intentional about how she shows up, or she has a clear idea on what her style is. So again, getting that clarity that you need to really elevate your personal look. Again, starts with the foundation, and that's
And I think that word, being intentional, that's
where it really starts.
That's where it is.
I think intentional and just caring enough to say,
Caring
you know
enough.
what, I'm just gonna this season, I actually just wanna shake things up. I wanna just elevate. I wanna walk into the office and everyone's like, where are you, where are you going after work? You're like, I'm not going anywhere, this is just how I look. This is how, I just woke up like this, So I feel like you wanna, again, own that. And I feel like as women, it's really important to own you're sexy. And a lot of women is like, oh, that's cute, I don't wanna be too sexy. Why not? Really with once, wear what feels good. So I really think that as women, again, being intentional is super, super key to really helping you kind of build on that and really help you build that personal style. It is not a race. I feel like that line is, it doesn't happen overnight. It just takes time. You will get there, but just taking those baby steps will actually help you get
And
there.
to play off of that, and bring Sarah into the conversation, is because I think, thank you, is that, again, a lot of these things, they don't happen overnight, and you have to be intentional about it. And so I want to ask Sarah, what does the ideal week of exercise look like? What is a good training split?
So everything you just said are words that come out of my mouth. Train with intention.
Yeah.
It doesn't happen overnight. My ideal for most women, now we all have different goals, but strength training should be 2 to 3 days a week, right? And then cardio, we want 1 to 2. I'm gonna say 2. Ideally, we're working out 5 or 6 days a week. And it can be hard, and consistency is not what you think it is.
consistency is not, I show up every day, I don't miss a day. It's more like 80-20, right? Because we all have work, we have kids, we have parents we're taking care of. Life gets in the way, so we'll have a week where we don't make it in, but you want to get back on track, right after that. If you're new to the training world, you just have to stick with it and keep showing up. Training with intention is also not just like how many days a week, it's I am strength training and I am doing cardio. And again, I know we all love our Pilates classes. I love Pilates, it's having a big boom right now. But it's not serving us, especially in midlife, the way that strength training is. So I'm all for Pilates, I do it, but it's more like I do it once a month, you know, or some women I know do it once a week. They prioritize strength training, cardio work, and then Sundays they go with their friends to Pilates classes. It's a great movement, but it's not giving you everything you need. Yoga, same thing, I love yoga, but you're not getting what you need out of it. So when I tell women, know your bodies, know what's happening, train with intention, meaning do the right movements, because we don't have room to not do it with intention, right? It's just, our bodies are working against us as we get older and through that midlife, and we need to set ourselves up for what's happening and then for the rest of our lives. So I would say 2 to 3 days a week, strength, the other days cardio, and then the other days are whatever you like to do, be Pilates, yoga, long walks with a weighted vest, whatever.
And to ask Dr. Sonali, also, just in terms of prioritizing when you spoke to that a bit about our healthcare and really advocating for ourselves, is there anything else that you think is really important in terms of, as we get older, and we talked about heart health, just also, I don't know if it's about the visits to a primary care physician or any other things that are important that maybe we should be more aware of that we don't exactly know.
So I think, no, there's a man in the audience, so I don't want to ignore you, but, you know, I feel like making sure you have a good OB, or at least someone that knows hormones. I think this is the age where in perimenopause is, you know, it's like everything's kind of in the air, right? It's like everything's moving around and there's this fluctuation. Your progesterone is not stable, and you know, but if you're having your testosterone may be dropping, your you know, your estrogen is still there, but it's kind of like, and everyone has different responses and everyone has different times when their estrogen is going to start dropping, but it's like not ignoring the symptoms. So like, what does low progesterone mean? It means like I'm having trouble sleeping at night, I'm suddenly like puffy, or I'm having, you know, like, so I guess what I would like to say is be intentional of your symptoms. And you know, I think as women we have a tendency to put everyone else forward. We always say, okay, well, it's probably nothing, or it's this, or you know, I'm a little anxious, oh, it's probably my work or my husband or whatever it is. But it's like low progesterone is anxiety, difficulty sleeping, you know, like feeling a little doughy, you know, that's what is low testosterone. Low testosterone is poor muscle mass, low libido, you know, mood. And, you know, and so I think these are all things that I just want my patients to be aware of, and that's the hormones. The other thing is like, just like I had mentioned, is like advocating for certain tests, certain more specialized tests, which are going to focus on your health. Especially if you have a family history of everything. No, I'm gonna tell you right now, doctors are so over, like I think you may go to a doctor thinking, oh, this person should know everything, right? But we don't. And it's like, I will tell you, when someone comes to me and is like a little bit more assertive of what exactly they are coming for, plan your visit. Say, okay, this is what I want out of this visit. Because the doctor has like 15 minutes, maybe 20, to figure you out. And then next one. know exactly what you're going in for. I have a history of, I don't know, family colon cancer or whatever, anemia. Go in, do some research, and advocate for yourself. Don't expect the doctor to advocate for you. I mean, it's great if they do, but I don't know everyone's doctor, right? And I don't know if I don't know if you're paying $1,000 a visit or you're going through a network or whatever it is, but I'll tell you right now, there's a world of difference.
Yes.
And know that. So.
Is it helpful also as a patient, or like when you see a patient that's also perhaps keeping a diary or tracking their symptoms so they can really speak to it more specifically?
100%. And also don't be afraid of being annoying. Like I think sometimes when a patient walks in, and I'm just gonna be really honest, patient walks in with like a long list, I'm like, oh my God, shit, right? But it helps me because then it's like, okay, I don't have to like piece this all together. It's actually like giving me a little bit of a roadmap. Don't be afraid to like fight a little bit. Doctors see it all the time. Go in,
Advocate for yourself.
advocate.
Can I just share my
Yeah.
personal story?
Please.
Lana's aware of this, but on top of advocating for yourself. So you look at me, I'm a fit woman, and if you were in class with me, you'd see the type of output weights I could move, and you have a thought, I'm a healthy, fit woman, right? Many of the doctors I've seen in the past year have the same thought when they see me. I've been to several doctors, and it was, it's just hereditary, I have been tracking symptoms. It was when I finally went to a gynecologist, and she was dismissive. She said, oh, look at you, we're gonna get you in and out. This is regular, just annual exam. And I said, wait, I have questions. I have symptoms, I have things, I wanna make sure they're okay. So I listed them off as she's doing the exam. And then at the end of the exam, she said, okay, based on what I feel in your uterus and your symptoms, I'm gonna have you go for an ultrasound. And by the way, I don't feel terrible. All the symptoms I had were like, maybe it's that time of the month. Maybe I'm in perimenopause. They were so things that could be anything, right? But I just said it to her. And it was when I finally had the right list of symptoms, because I had said it to another gynecologist. When I had the right list of symptoms, she put it all together, and it turned out that I have endometriosis. I didn't have any idea. I was not looking for a diagnosis of any sort. I just was curious why I have these symptoms. But had I not tracked those things, had I not kept going to more doctors, had I not said, wait, I have questions, I still wouldn't know that I have it. So again, know your bodies, pay attention, don't assume that it's just normal, like you said, and bring it to your doctor and advocate for yourself, because like you said, doctors are overworked. They don't have a lot of time. They only know what they know. So the more you can give them, and then one other thing I will say that I tell women, because I work with prenatal, postpartum women, if you have complications in your pregnancy, like for me, I had hypertension with my kids, tell that to every doctor you meet, right? Because I had a doctor put me on estrogen birth control, and I ended up in the emergency room with high blood pressure through the roof. So share that with every doctor you meet, whether you have gestational diabetes or hypertension like I did. Those things matter, and it will matter down the road as you're going through midlife. So again, like you said, advocate, because you just have to know your bodies, and you have to be there for yourself.
And I want to wrap up this segment. I'm going to open up to Q&A in a moment. But I do want, in closing, maybe Sarah, I think, well, I don't want to put words in your mouth, but I was going to ask everybody to, I want to ask each of my lovely panelists here to tell us what's next for each of you, and one tip that you believe every woman should live by. And before I do that, I guess I'll start with myself. And for me, what's next for me is really to continue to grow this community. And if this is something that has resonated with you this evening. What's really helpful for me is to get your feedback. You can message me on Instagram, or I can give you my email or my phone number, but I really want to create a community, a larger community, and do more of these conversations. And also I'm open to your suggestions for my podcast, because I want to talk about relevant topics that are important to all of you. So that's really, so I guess that's what I wanted to say for myself. And I guess that one tip, I guess is what I said, that I believe we should live by, is that it's never too late. It's never too late to reinvent yourself. I don't care if you're 40 or 45 or 50 or 55 or 60, whatever. Until the day we die, we can reinvent ourselves. And whatever that means to each of you might mean something different to me or to any other person in this room, but it doesn't matter. It has to be what you envision for yourself. And quite honestly, I don't think it's about getting older, that it's like, you know, that we become irrelevant. We're not irrelevant at all. I really think what equals death is stagnation. It's not being able to evolve. And so that, I think, for me, is what I've realized is key, is the ability to evolve and to reinvent yourselves, whatever that means, to bring you joy, and so that you can live your authentic selves.
I think for me, I guess the first question is what's next?
Yes.
So, I mean, I've been doing this a long time now, and I think what I'm really excited about is how finally women in, I guess, my age group are hopefully not being ignored. And I am very excited because I'm on this journey too, and I go through a lot of this stuff. I experiment a lot on myself, and you know, I'm excited to be able to not. I'm excited because now it's like there's at least it's a conversation that's being had. What are these symptoms? I want my patients to. I'm gonna say my one tip is advocate for yourself. Make sure you speak up. Don't ignore your symptoms. Don't, even if you think it's nothing, just, you know, be able to just make a list, write it down, just something. And I want to be, when I'm, you know, in my practice, we strive really hard to sit with our patients, go through everything, because I've been on the other side, and I know how scary it is, and I feel like I have a lot of resources. I have friends, and I always think, I'm like, God, like, I find this so hard. Like, I can't even imagine what, like, people that don't have, like, friends that are doctors that you can just call, like, how do you manage this? It's so, please advocate for yourself. Please take time, give yourself that gift. Yeah, that's it.
Well, what's next? I actually didn't even. I didn't really mention this when we first started because I'm still kind of getting used to calling myself a designer. Being a stylist now for over 10 years, I've learned that I've seen a lot of outfits, I've seen a lot of closets, I've heard a lot of stories, and I wanted to create a collection, kind of step out my comfort zone a bit, and I always wanted to create clothing that women enjoy wearing and feel celebrated, and is not trendy and is timeless. So I created my own clothing line, and that's what's next for me. I obviously love being a stylist, but I think going through this journey as a designer, and I have newfound respect for anyone that is designing because there's so many moving parts. But I wanted to, again, create clothing that my clients enjoy wearing, that I just couldn't find when I like shopped for them online or in like store. So so next week, Friday, I'm launching my clothing line online, which is exciting. It's called 34B, and I'm pre-selling it to my clients and my network, and obviously everyone here. So that is what is next for me, and I'm really excited about it. I feel really proud about it. Again, it's because it's just, again, having a product and seeing it come to life, but also seeing it on people that you love, and I love all my clients. And kind of seeing, and then kind of seeing women wear it, and I feel like that kind of plays a role with like styling and seeing how putting clothing on and how it inspire people and how confident they will feel would just make me feel amazing. And then one tip I want to give is, I think as women, we put too much pressure on ourselves to be like perfect and great. Again, I think we have so much influence with social media, like that perfect lifestyle, all these things, and she's so glamorous, and I can never look like that, and blah. And I think like we need to be patient with ourselves and be kind. And I think when it comes to like your personal style too, I think that it's just like, as Lana said, like it is never too late to start. Like it's about having fun and reinventing yourself, whether that is with your style, whether that is with your hair, your makeup. Trying something new is okay. And I think that a lot of people don't like change, and I think change is the most powerful thing to go through life, because I think that is the only way that we're going to evolve as like people. Like, I mean, if anyone told me that designing a collection, what I have to do daily, and people have to speak to it, I'm making it in Colombia with a team that speaks no English, and I'm translating things daily, I would have talked myself out of this a long time ago. But I think that it helped me, you know, grow as a person. I think as women, we just need to be kind and patient, but also like just do things that make us feel good, and whatever you decide to start, whether it's a small business or your style, or I just want to change things up, just do it. Don't even think about it, just do it, because we only live once, you know? So I think that that's the biggest tip I can give.
I love that.
Okay, so what's next for me? I think for me, it's creating space for women to learn and know more about their bodies, and a place to do all the things I've talked about, strength training, bringing young girls, teenagers, bringing them classes so that they can build a solid foundation and build confidence through that, because we all know what it's like to be a young girl and body image issues. But just bringing more opportunities to women to feel safe and learn how to do the things they need to do, right? Train with intention. And then my advice, I think we all know being a woman is very hard. From a very young age, we start having changes, we go through life kind of suffering every month. We live life, we go about our day. Life is hard, you become a mom, maybe you don't. Life is hard for us forever and always, and it doesn't get easier in midlife. So just to steal the words of Glennon Doyle, I don't know if anybody know this, but we can do hard things, right? So we gotta step up, we gotta do the work, because it will pay off. And that's it.
Love that. Yeah. So, no, I love that. Thank you, ladies. And again, I just need to applaud these women here, because they're all a significant part of my life. And so it was really important to me that I brought them here together, because without them, you'd just be talking to me, which is fun, but not as interesting maybe. But I really respect each and every one of you and admire you, and thank you for being a part of this today. And for all of you out here, we're gonna do a brief Q&A, and then we'll break into the fireside chat, so that way you can speak to these lovely ladies individually and get more information, maybe buy some outfits from 34B. But I think it'll give everybody an opportunity to get, you know, more personal if necessary. So does anybody have any questions that they'd like to ask in this forum right now to any of the panelists? Yes.